China's premier has asked the European Union for help in sourcing urgent medical supplies to deal with the worsening coronavirus outbreak. 259 people have now died from the virus. That was after China announced a further 46 deaths. Earlier, Australia joined the US in banning visitors who've travelled to China. And American citizens who've been in China for the past 2 weeks will now also be screened and quarantined for 2 weeks. We've also heard from the World Health Organization's representative in China, who's defended the decision to declare the outbreak a public health emergency. He's also warned there'll be no respite from the spread of the virus in the near future.
This increase is likely to continue because there are almost as many specimens waiting to be studied as there are already reported. So the numbers will continue to grow.
Here's Scott Heidler in Beijing with the latest. Not great, then, that China is now having to ask the EU for help.
No, it's not a great sign at all, is it? Now, we know that, over the last week, 10 days, that there has been concern about just how much medical supplies are going to be needed for this. And obviously that has been growing because we're seeing a growing number of those infected. We are seeing growing numbers of those dead. So we knew that there was going to be a greater need, and it just doesn't seem like it's being met here in China. So obviously the Prime Minister, Li Keqiang, made a statement saying that he's hoping to work with the EU to procure more medical equipment. It didn't go into detail as to what exactly they're looking for. They're hastily building 2 hospitals down in Wuhan and then starting construction on one outside here in Beijing. That was a temporary hospital built during the SARS epidemic. But those 2 in Wuhan, you got almost 2,500 new beds in 2 hospitals that are going to need to be equipped. So I can imagine just those 2 hospitals and the need for equipment, medical equipment, would be great. But then you have all the other existing hospitals and the other existing needs they have. We knew, mid last week that there was a call out for more protective clothing for the medical professionals who are treating those who had been infected. So I would imagine that's one of the things they're looking for. A lot of those materials are manufactured here in China, but I would imagine that it just can't be manufactured quickly enough. You also have situations where maybe some plants are in areas, some factories are in areas that are really shut down because of the virus itself. So you've got this difficult situation, but a call out from Prime Minister Li Keqiang looking to get more medical supplies, particularly from the EU, here into China.
And what about the travel restrictions, Scott, the reaction to that? Because, again, it's just another negative sign for China having to deal with the restrictions being put on by other countries.
Absolutely. Now, it wasn't received well. The United States' move to restrict non-citizens who've been in China from getting into the United States. That doesn't include green card holders and relatives of citizens, close relatives of citizens. That was not received well here at all. Actually, they said it was not a show of good faith, is how they worded it here, the central government in Beijing. But one thing that's interesting, the travel has been restricted in the Hubei province. You've got even more restrictions almost every day within China. The Chinese government is actually chartering planes to get people who are tourists stuck, who are Chinese citizens who are stuck in Hubei province, to get them out. Obviously, they'll be screened first, to get them out of the province and into their home provinces here in China. So that's obviously something to try to alleviate maybe some of the stress that province is already facing. And one other thing I'd like to note, we were talking about this last hour, Kamal. Apple has announced that it's closing its offices and stores at least for a week all across China, in mainland China, for at least a week. They're going to reevaluate. This is following Starbucks has done something similar. McDonald's has done something similar here. But one thing to look at in the Hubei province, you talk about the economic impact of this virus here in China, and that has knock-on effect around the world. There are a lot of factories, auto factories in particular, down in Hubei province. Those are shut. Those will be shut indefinitely until they can get a handle on how this virus is spread and what they can do to contain it. So, we're going to have this supply chain issue moving forward. Like right now, it's kind of a bit of a grace period because most of those factories would have been shut for the Lunar New Year holiday, coming back online probably on Monday. That's not going to happen. What's that knock-on effect going to be? We'll have to see.
Thank you, Scott Heidler in Beijing. Hong Kong's chief executive, meanwhile, has rejected calls by a medical union to close the border with mainland China to try to halt the spread of coronavirus. 13 cases now confirmed in Hong Kong. Wayne Hay is there for us.
The authorities in mainland China are struggling to get on top of this, given that those statistics that are announced daily from the National Health Commission are certainly worse than the previous day. 46 deaths confirmed on Friday, and those latest numbers that were announced on Saturday morning by the National Health Commission. Most of the infections and the fatalities are being recorded in Hubei province still. That is where it is thought that this outbreak began, and certainly there the medical staff are struggling to deal with the sheer number of cases. Thousands of extra doctors and nurses have been sent to the area from other parts of China, but there is still a shortage of medical equipment there, in particular the protective suits that those medical personnel need to wear when dealing with the patients, and also test kits. And that is partly why many experts outside China are saying that the actual number of infections will be a lot higher than what the Chinese government is recording. Also, there is a shortage of hospital beds, and that's why everyone is eagerly awaiting the completion of 2 makeshift hospitals that are being built in that provincial capital, Wuhan City. We expect those hospitals to be completed within the next week or so, and that will mean an extra 2,500 hospital beds. But this virus has now spread to every single province and territory in China, including Tianjin in the northeast, a long way from Hubei province, but a city that neighbours the capital, Beijing. There are 32 confirmed cases in Tianjin, and the local authorities there, the local government, have announced that they are ordering all schools and non-essential business to remain closed.
And from Hong Kong to Thailand, Alexi O'Brien is in Bangkok, where Thai officials have been giving an update on the virus there.
They have confirmed that the number of confirmed cases remains unchanged at 19, but the number of suspected cases here in Thailand has jumped to 344 from 280 on Friday. They're not saying that's because the virus is spreading much faster here. It's actually because they've widened the net. They're now looking at people who have arrived from cities outside of Wuhan, the epicenter of that outbreak, but also Thais who may have come into contact with Chinese tourists, for example, because China is the biggest source of foreign tourists for Thailand. There have been about 2 million people come through just in December and January since the outbreak began. So if you have a look at the map behind me, though, there has been a map made up to show the outbreak as it stands at the moment. That big red circle is Wuhan and China's Hubei province, as I said, the center of that outbreak. And down a little bit here, you can see the red flashing dot. That is Bangkok, and that's because Thailand has the second highest of cases, 19 outside of China, and also authorities here say Thailand remains the most at-risk country outside of China because of the number of people travelling back and forth. But that number, 19, is dwarfed by the number, if you move with me here, of 11,300. That's the number of global cases. Most of them, though, are in China.